Hi, everybody. Thanks for joining us for another episode of ASAP Pathway Podcast. I'm your host today, Dr. Stacy Ochoa, and I have the honor and privilege of hanging out and getting to know our next guest over the last year, Nerissa Boggan. She's an orofacial myofunctional therapist, and this topic is a much needed topic, especially if we're going to be talking about the well-being and health and sleep of children. And I met Narissa actually a few years ago, just in this whole journey. And we were starting to launch ASAP Pathway, and she was such a cheerleader for us. And she was so encouraging. And she's like, you guys have to do this. Keep going. Whatever you do, I want to be part of it in some facet, because she's all about change and she's about changing the world. She is amazing. And for those of you that don't know much about her, I would love to do an introduction before we start our conversation. Narissa is a graduate of the University of California, San Francisco School of Dentistry, Dental Hygiene program. She's a perennial learner and an experienced practitioner and leader in the dental field, in private practice in both general and periodontic dentistry. She has been involved with the California Dental Association CARES program and the Solano County Public Health and Social Services System Children's Dental Disease Prevention Program. Narissa brings a wealth of experience to the dental industry and is a regular attendee at dental and medical conferences detailing education for optimal airway growth, development, and function. I also want to dive into another part that's very passionate for her. It's another reason why I love her so much. She is a presenter on sleep, healing, and recovery as a fundamental element of self-care practice at the Advanced Peace National Violence Interrupter and Community Healing Bootcamp Academy. By supporting improved health span and lifespan of emergency first responders, violence interrupters, and community mediators from around the country. These credible messengers are working to build healthier, safer, and more just communities by transforming the lives of individuals at the center of gun violence healing communities, the Community Violence Intervention, the CVI. Good morning, Narissa, and thank you for joining us. I'm so excited for you to be here. I know you are one busy mama. You are always, every time I open Facebook, you're traveling, you're at an event, you're learning, and perennial learner is just a perfect description of you, because you are always learning. You're such a open book. You're such a sponge, and you love to take it all in. But what I love about you is you give it back out. I just adore you.
Oh, thank you, Stacy. I really love not just learning in terms of academic right here. I love learning people.
I feel that. I feel that from you 100%.
I love relationship. That's how we are built, right?
Yes.
Community.
And the community and doing this together. We were not designed to do this alone and navigate this all by ourselves. We were designed to work in communities with each other, listen, learn, share, take time, have conversations, which you're excellent at. And I strive, I'm hoping to do that with the podcast to get things out. And having you on this podcast to me is very important, that we talk about this topic. You started off as a hygienist.
Yes.
So
I did. So I graduated many years ago.
yeah, I like that. Many years ago.
Many years ago. And that afforded me an opportunity to really raise my kids, for those that are listening, that are hygienists, you have a very flexible hours, right? So I already started to, like I said, I made conscious decision that my kids come first when I start kids. So I just work 3 days a week, even graduated from dental school. And I was fortunate to find a periodontist and a general practitioner as well that allowed me and accommodate me. They were good friends of mine as well to do that. So drop off my kids, went to work, left work, pick up my kids from school. So my kids never really had opportunity to be on after school care. I was there. So I was their driver for many years, for 18 years. I'm empty nester now, so I'm enjoying that part. Thank you, Lord.
Thank you, Lord.
So I get
Right.
to really, my husband told me, I have my wife back. So for what he does for work, I get the opportunity to travel with him if I can. So I do practice twice a week, Tuesdays and Wednesday in Lafayette, California. It's east of San Francisco, the Bay Area. And I had this is the part that you want me to go to my training, Stacy.
Yeah, like let's hear how you
Yes,
got this
so
training.
Yeah, so even at dental school, my passion is actually public health. I was actually really into public health. We did a lot of community work in dental school, and I got pregnant with my daughter, so I did not pursue the master's in public health at UC Berkeley. So again, I made that choice. So I became part of that community in my small county at that point to be involved in going to schools. And I picked the ages between third grade to fifth grade for whatever reason. I love going to those classrooms and visited them twice a year, beginning of the year and towards the end of the year. And we would do sealants clinic as well. So that's been in my heart. And also I'm married to someone that are actually in public service. So that's really big in my family. Let's see, I am working 2 days a week in Lafayette, California. The rest of the days I'm admin days and I'm traveling and learning like all of you. And we're all in this whole continual place of learning, and fortunate enough that I am part of a study club here in the Bay Area that we meet in person. And I chair that as a seat chair. I'm very fortunate for Brian and Kevin to actually facilitate that environment for all of us to collaborate and learn together. I got my training through first one. I love Mark and Samantha, the IAOM. I'm sorry, the AOMT. Joy Moeller is also my mentor. A couple years after that, I had a training through the IAOM, Billings and the Davidson. I'm also a one of 30, I believe, or 31 first graduate of my masterminds through TBI. I love that family.
TBI,
you know me,
the Breathe Institute for those that, and that's Sarush Sagi's program, correct?
Correct. And those are the three big families that I actually would say so happy that I'm part of.
You know what's really interesting? I used to be a hygienist too. I mean, I think once you're a hygienist, I think you're always a hygienist inside. So I think I practiced dentistry differently because I was a hygienist before I went to dental school. But I think dental hygiene is an amazing career. I also think there's days sometimes I'm like, why did I go to dental school? It was such a good career. But the mid-level provider is really being elevated now. We see in medicine, right? We're seeing the nurse practitioners, we're seeing physician's assistants, we're seeing more clinics being ran by them and them being a little more elevated as well in medicine. And I really feel that the hygienist should we need to look at dentistry. It's a very archaic model still. I think we need to get a little more progressive and start elevating the hygienist as the providers that they are. I think there's so much they have the capacity to do that they could learn. And one of those things would be, orofacial myofunctional therapy. And, even a few of my hygienists have even said, hey, someday maybe when I'm no longer able to do scaling and root planing, I mean, that's hard on your body. It's hard on your body that there's this other career that they can take their degree and change lives that way, as well. What made you want to go that path?
For sure. So when I was in dental school at UCSF, I have a good friend. His name is Kevin Adair. He's the orthodontist. And I remember he was a GP at first, and he decided to go to ortho school. And so when he moved back in my area, he became my kid's orthodontist. And then this is what he told me. So we hang out a lot in dental school. So became good friends there. He goes, Narissa, I'm into this airway health. I want you to start learning. Because I know when your son, Caleb, leaves the house, you want to do this. So, Stacy, you know me right now. Once I get in, I'm like, my husband always tell me, you're like a bulldog. You get on it and you would not let go and just going. So I was there. And that's what you were saying about dental hygienists. So while I was in the perio office, I'm no longer practicing dental hygiene, by the way. So just FYI, I actually did myofunctional therapy without patient knowing it. One is start with education, right? Getting them familiar with this upper airway, why they're sleep fragmenting, why are they having some hypertension, diabetes, they have metabolic diseases, right? So I start giving them certain exercises, and main thing is awareness
Yes.
of this.
Awareness.
We
Yes.
have the control. Mother Nature gave us the control of this, right? And so even then, I was doing myofunctional therapy. And then until I finally got my formal training through the AOMT and IOM. And it was up until 2028, 2019, I started my 2018, 2019 private practice in Lafayette, because the group of people that I'm with now in a study, they said, hey, we need support. When can you do this? So I took the leap of faith. And I have a friend of mine, a good friend of mine, that actually sponsor or house me in his private practice in Lafayette. He's an oral surgeon. He's a fantastic oral surgeon. So that's what I'm doing right now. And as a hygienist, and I do present to local dental offices as well. And because, as you know, you can't be coming from a conference and say, I want to institute this in my private practice. But your team,
Yes.
what do you mean? As a hygienist, you know that, right? You only have certain amount of time. You come in, you check in the patient. Part of that is what? Blood pressure screening, medical history review, full mouth probing, right? Then you
Right.
have to take it away. And then you have all of that. And then the dental hygienists were like, wait, what? And then you want us to now screen for airway. So I created some sort of tools that I utilize as well for a hygienist to screen properly.
Oh, I love
And
it.
then possible referral. Yeah. So anyway, that's what I did for a while until I got into full time of myofunctional therapy.
So I'm sure there's going to be hygienists listening. I'm actually going to send this podcast to my hygienist so they can hear this discussion.
It's
And
really not. You know what? I tell them I had an opportunity. I was invited UOP, University Pacific Dental School in San Francisco. It's the Association of Dental Hygienists. I told them we're in the forefront of this healthcare. We are actually health coach.
yes.
We guard this space, and they see us often enough that you could empower your patient, right? Empower your patient to learn how to breathe properly. Teach them how about just the, teaching them what is the correct oral posture. I'm watching you right now, Stacy. You have a perfect one. Lip seal, nose breathing only.
Oh, thanks. Because I'm kind of hunched over. I thought you were going to point out how bad my posture was.
No, yeah. It's one of those things too, myofunctional, how, okay, so we're now getting into a little bit of the therapy part. We have this thing called disassociation, right? So every time I do push up, always think about that. I have to disassociate my stomach, not dipping when I'm doing my shoulder drop when I'm doing push up. It's really hard for some kids, that disassociation, lateralization, right, of your tongue, when you lateralize it, jaw not moving. So when I'm doing push-up, I make sure when I do that push down, all my shoulders coming down, my stomach is not also bending this way.
Yeah, right. That's my kind of push up. Like, wait, that's cheating.
That's cheating. That's cheating. Yeah.
It's cheating. Yeah, I mean, my hygienists know, they've been with me a long time. I've got a newer hygienist as well, but I've always been a big fan of the hygienist. I feel like, when I was practicing dental hygiene, literally you're the first provider that the patient is seeing. You see the hygienist more than you see the dentist, really, unless you have a lot of restorative or prosthetic care that you need. Then you're seeing your dentist a lot more, but you're really, your maintenance aspect, you're seeing that hygienist, and that hygienist has so much power. And I have also learned this too. This was very interesting for me, transitioning from the hygienist to the dentist. Okay. I was so used to, when I would speak to my patients, they hung on my every word. They asked my opinion. They waited when the dentist left the room. What do you think I should do? Right. Then I became the dentist, and then that went away. And so then I was like, wait a second, there is a power that hygienist has, and a connection with the patient. So I have learned now that I'm the dentist, and as much as I love to talk and educate, sometimes they do listen to me. I hope they do. I hope my patients listen. But I have learned that the power of my hygienist is, and I wish we would change the name of it. I think when people think dental hygienist, they just think of a tooth polisher, and it's like, oh my gosh,
I say health coach provider.
Health coach provider. I mean, I think we could come up with a lot better names than dental hygienist, but I don't even like the word dentist. I'm an oral physician, but whatever. So I have learned to shut my mouth, and I just empower my hygienist. So when they find things and they're giving me the findings, I love when they're talking to me about the things they're seeing. We have a possible tongue thruster, and I just shake my head and I go, I agree. Or I'll say, good eyes, like good catch. I see what you're saying now. I empower my hygienist, and basically I just echo, yes, I agree with your findings, and give my seal of approval. Yep, I agree. Because I think the more I talk sometimes as the dentist, the less the patient's listening. So I just have a lot of respect for the dental hygiene profession. I do.
Stacey, I was going to say, it's not profitable for you to spend that time, all that
It
time.
really isn't. And they want me to get the heck out of their room. Let's get real. They don't want me standing in there because they got stuff to do and they got to turn their room over. I mean, they don't want me hanging out talking. And, we've got our special code when they want me to get up and leave the room too. So you're right. It's not profitable.
Nope. Empower your hygienist.
Yes. And I do a lot of, yep, I agree. That sounds good. Sounds like a plan. Stand up and leave. Because they know what they're doing. And but I really think dentistry needs to, we need to have more of a mid-level provider view of the hygienist. I think even with an ASAP pathway, we're always like, how can we incorporate the hygienist more? Because I'm a big fan of, basically, to me, I can train all the dentists in the world to do this. If they go home to their team and they have a blank stare of, now what do you want us to do? Like you just said, we got to have the teams on board. So like for us in ASAP, when a dentist joins, we are highly, highly encouraging them to please get your team members into the ASAP program. They can watch Nicole Goldfarb. They can watch all the stuff on myofunctional therapy. And those are your big hitters. Get your hygienist, get your assistants, but that dentist is not going to change the lives that they can change if their hygienist and their assistant is not on board. It's just not going to happen. You have to have that team behind you. So do you have your own practice then you do?
I do.
Okay. And you're doing that 2 days a week now, correct?
Interestingly enough, like I said, I was in a perio office, and majority of perio office patients are adults, right?
Yeah.
So when I started, So when I started my functional therapy, I'm getting more children, and I'm used to talking to children through a school setting, right? So now that's why I only see 6 to 7 patients. Actually, 7 is even a lot. I think I've only had 2 to 3 days in a year that I actually saw 7 myofunctional therapy patients, because it's exhausting. All I do pretty much is just talk, right? As a hygienist, after your first 15 minutes, start cleaning, your jam.
You're
I
in
could
the
have,
zone. Yeah.
I'm in the zone. I'm praying. I'm, memorizing and going through my, acronyms of my training. But anyway, so again, it's really exhausting for one to do therapy. I don't know. One thing that we don't have though, as a myofunctional therapist, we don't know, just like a dental hygienist, we have the set in dental school. You come in, you review your health history, right? There's no protocol per se of okay, you sit, you take x-ray, you go over medical history. I actually did a little bit of protocol on my own. So I have my own protocol that I've actually instituted in my practice, um, taken from my training in dental hygiene, my training in public health, my training through AOMT, my training to IOM, and I have my own protocol that I actually do all the time. Could be as young as 6 to as old as 72, because brain likes repetition. When
Yes.
when you do myofunctional therapy, there's a stage that we call intensive phase, that they see me weekly, right? Brain likes bad habit are formed the same way as good habit. The brain does not know the difference,
Right.
right?
It's
It's the
just
same neural
repetition
pathway.
over and over. You're going to do something
Right.
good over and
Neural
over
pathway
or bad over
or
and over.
bad over and over. Correct. So with that, I have instituted, pretty much so my kids come, they already know. This is what I'm going to do. I'm going to sit. They exactly know where they need to do and what part of the appointment at that point that is the next part.
So
So
are you doing any training yourself, Narissa, for hygienists?
training some,
Do you train at all?
am I training? It's weird. People have asked me, and I said, I would just, so what I've done is people that I've met, dental hygienists that have gone through training, doctors that have gone through training, they email me or call me, and I give them sort of my protocol, and then they could tailor it according to their practice. No, I don't. Like I told you earlier,
I
Stacy, I
know.
don't want
You're
to
like, I
work.
don't want to work that hard.
No, I don't. My daughter was telling me, she was with me for a whole week, and we were just talking, and she's traveling through Southeast Asia for a month. What an
Wow.
opportunity for a
What an
24-year-old to do.
opportunity. Yeah.
So she's in banking. I think I did something right there, Stacy. She's
Yes,
in
you did.
banking and she loved it. Yeah. She said, Mom, she just thanked me. Should drop her off the airport. She just thanked me. And she said, Mom, so what's your next thing? And I said, what do you mean? She said, no, I think I don't want to work that hard, sweetheart. I love my church. I love my volunteer search and rescue. And I love the people that I meet. I love to get to see a SAP family, the TBI family, the AOMT family. I just love that part of my life. We talked about this earlier about choices, right?
Yes.
So
Yes.
what you want? I mean, I don't want to wake up at 70 years old and I say, "Oh my God, I did not get to do what I really enjoy to do."
Yeah.
I'm enjoying my functional therapy, seeing patient. I'm enjoying traveling with my husband. I'm enjoying seeing friends, familiar faces when I go to conferences. But right now, there's so many out there. I have to really just pick 3 this year.
I know. I'm like, oh my goodness, where's she at now? I mean, you were constantly, but some of that, like you said, it's personal travel, some of it's business travel, some of it you blend it. But yeah, what I think is a really interesting perspective too, if there are any hygienists listening too, is that this gives you freedom to live the life, right, that you want. And really, I mean, and that's kind of too, like within dentistry, I love dentistry because I can choose my hours that I work. I mean, yes, I am tethered to a dental chair, but even within ASAP, that's providing me some freedom and flexibility to do things I want to do with my family. And I think a lot of us, at the end of the day, that's what we have. We have our families and we have our mission, what we feel called to do in life. And we want to make people better. We want to leave a ripple effect with our lives on this planet, which you're definitely doing. And I hope to do. And our legacy through our children. And you don't want to wake up one day and you're like, oh, I was completely absorbed with work and I have no legacy. I have no ripple effect because I've just been head down in the trenches, just doing it. And I think for a lot of people, we go through these waves of awareness of that and pulling back and going, wait a second, prioritize, what am I really doing here? How hard do I really want to be working? Right. I want to make an impact, but not kill myself doing it. In your practice, so when you started getting into myofunctional therapy and you've done so much training under the umbrella of all the different associations that exist, this is something that's emerging. People will say, well, where's the research, right? Where's the research that myofunctional therapy is effective? Well, we know it's effective for habits. I mean, we can see the pictures of a tongue thruster and how they've just completely obliterated. The tongue is just blown out the front teeth. They're sticking out everywhere. I mean, the muscles are the bullies or they are the friend to the bone and teeth. So the muscle always wins. So we know we can see the changes anatomically in the dentition and the dental arches when you get those muscles balanced. What about the airway? What about sleep, breathing? What are you seeing in your practice? And we talked a little bit about the research that, Dr. Guilleminault. Yeah.
And also Camacho is the one that came from Stanford. So my experience when I really first doing too, a lot of patients would come and say, hey, I had MSC already. I had an expansion. I have surgery in my face, but yet I still fragment. So, and I know you're into this, the non-anatomical of sleep disorder breathing.
Yes.
So
anatomy matters, but there's more to the, yes.
Exactly. It's, we know OSA, sleep disorder breathing, very complex, multifactorial. And then, people have asking, how do you know when a patient have graduated from a therapy program? There's no graduation on the therapy program. You gotta, like in life, there's maintenance. Stacy, when I don't know how long you practice as a hygienist, but I remember, you know what it feels like when your 3-month recall patient with generalized bleeding and probing came back to you 3 months later and actually stippling on the papilla and already no more bleeding. You feel like, oh my God, you're happy. And guess what? What you did really mattered, but what they did between that visit mattered the most.
Yes.
Right?
It's what they do at home. Yeah.
Right. So we know the gratitude, the feeling that we get when we know that we've empowered patient about, hey, you got to brush and floss at least. Right.
Right.
But to actually impact patient and say, hey, thank you for helping me, that I'm now breathing and sleeping well. And that's what myofunctional therapy could do.
And what are the things, give us some examples of maybe a child that came to you, their before and after kind of, aha, this is so rewarding. And this is how I help this child with their sleep fragmentation, with their breathing, with, because people don't understand too, when we're talking about, I know we say airway sleep in pediatrics, and we talk about sleep apnea or sleep related breathing disorders. A lot of times it's not just sleep. These patients breathe poorly 24/7. They have a breathing problem. It's not just the airway not being patent at night from low tone or inflammation or poor anatomy. it is, they don't breathe well, period. And then at night, they're just more susceptible. And we have a decrease in our sympathetic tone, and the parasympathetics kick in. And you take a probably already compromised breathing situation, and now it's a train wreck once the sympathetic tone is turned down. So, for instance, there's a rate of breathing, there's a depth of breathing. We are supposed to breathe with diaphragm, not with our chest, right? People don't know that. They don't understand. We've got kids walking around mouth breathing, which is hyperventilation. So, I mean, what are the things? I'm sure the parents are probably like, what? Like, no one in our culture, we're not taught how to breathe. I do know that in some Asian cultures, they are like, close your mouth, keep your lips together. There's a way to sit. They're big on posture, chin up. In America, it's mouths hanging open. It's okay. Crusty noses, rolled shoulders. I mean, it's anything goes here, and a lot of other cultures. So what are you seeing like before and afters, like that's like, life-changing for this child?
So I want to go back to, well, half of my patient base are actually self-referred. Parents are actually out there Googling there's something wrong with their kids, right?
I think that's amazing because there is an awareness. Something is happening in our society where people are being advocates for their own health. That's wonderful. I'm glad you got like half of those
one
people.
thing too, and I'm gonna say this too. I think in the next 5 years, 5 to 10 years, we're now gonna see more adults having this awareness, and then going to find providers. And we don't have enough providers that actually could do adult expansion, or even our struggle right now with some orthodontists that don't want to see kids.
Yes, that is some of our struggles. Yes.
Right. So we know
Right.
the struggle is real. So because of that, majority of them would say, what is myofunctional therapy? So then I have to educate them. Right. So I empower them with the information out there. But when they come in my office, I really just want to spend 30 minutes with a child. First initial with the child, 30 minutes. I want to know if they even know how to breathe in and out. Can they blow their noses? Can they clear their nose? Right? I want them to be familiarized with their tongue. I want them to be really familiarized on their face, not touching their face, but can you blow your nose? Some of the kids, you ask them to blow, they inhale.
Yeah. They don't even know how to have nasal hygiene. That's not even taught, which that's the thing, Nerissa. It's like, this can start at birth. You have a child that gets a cold, a viral infection. They stop breathing through their little nose. And it's like, you do have a lot of moms that aren't really familiar with nasal clearing. I mean, the pediatrician says, okay, do some saline, but sometimes that nose is never turned on again. The child learns to mouth breathe and they have nasal disuse.
For sure. Yeah. So that's the first thing I do. I really want to get the nose going. I wouldn't even touch them at all because you cannot habituate lips closed, tongue up, if this nose is not going to breathe properly.
100%. Get that nose open. Yeah.
Awareness is number one. I really spend with them awareness. I give them awareness, and we watch videos just like I got from, a curriculum that I wrote. We watch videos and I educate them about the importance of lips closed, only breathing through the nose. I start there. And then I make referral. I don't have a lot of orthodontists in my area that could actually expand younger than 6 years old.
Yeah, that's kind of this is what we're out there for. We're trying to get more people that'll see that demographic of kiddos that they're off the radar orthodontically, and they need room for a tongue. They have a train wreck mouth because they've not been breathing well through their nose. And we see the car accident. We see that malocclusion. And yeah, we need more dentists helping and working with an orthodontist and pediatric dentist. Oh my gosh, the pediatric dentist. I keep telling my friends that are pedo, like, you guys could be changing so many lives. Just, you got to get out of being a cavity bug doctor. You really do. You got to pull back and look at this child in your chair, because the impact these pediatric dentists can make is insane.
I mean, it's actually problem state of the nation right now.
Yeah.
It's It's very common. To be honest with you, I actually wrote an email I sent to patient, but it's so common. I titled it Myofunctional Therapy and this Sleep Disorder Breathing, because every single one that comes to me, kids are not breathing well, have a sleep problem at night, bedwetting at night,
Yeah.
problem behavior issue, right? I have quite a bit of older people as well, but these are takes maintenance. Now they're on either oral appliance therapy or CPAP.
Yeah.
They
I
don't want
think,
to go through that. They don't want to go through that. They don't want to go through the whole thing as an adult.
yeah, I started off seeing adult airway patients. I mean, I've been doing that for about 20 years. And then I had my own children. I'm like, wait a minute. They're going down the wrong path here. And nobody really had answers, but beyond tonsils and adenoids. But it's so interesting that these sick adults we're seeing, like I hear from a lot of adult airway sleep management dentists. They're like, well, we don't want to see the kids. I mean, we just, they just might do an advancement device, and that is needed and it's helpful. Okay. But it's management. Let's not kid ourselves. We're not curing anything. Okay. We're just basically doing a little CPR. The CPAP is blowing and we are advancing, doing a little bit of jaw thrust, right? Like it's CPR, it's management. But if you want to look at root cause, you've got to look at the craniofacial respiratory complex. You have to look at the lack of tone of the tongue and the muscles. You have to look at nose breathing. And unfortunately, we have a lot of adults walking around that got sick as a child. And that's, most of these adults, when I talk to them, I wouldn't say 100%, okay? But a great percentage will tell me I've never breathed through my nose since I was a kid. So, and you see the vaulted palates and it's like, oh, it's like if we could go back in time and intervene, right? So what are some success stories for you, Narissa? Like what is like gives your heart joy that you're like, share some stories.
So, my success story is a lot. It's a lot. My patient never really leaves they never really leave my practice per se, because it's maintenance.
Yes, it's
Life
maintenance.
is maintenance, right? So I would have patients that have actually graduated. I would send them some questionnaire, a parent or patient assessment, and it would trigger them like, aha, and then they would end up coming back. So I always call that as, a recall to make sure you stay within normal function.
Right, because it's just like going to the gym. Just because you went to the gym and you're pumping iron and doing all your rowing amazing for 6 months, you're not good to go for the rest of your life. You got to keep doing it.
Yeah. I had one patient that actually graduated. It was on my recall for a bit, and she developed chronic congestion, gifted a cat, and start sleeping in her bed.
Oh no.
So
Here
we
come
know,
the allergies.
right?
Yeah.
Right? Here comes the allergy. So it requires maintenance. So there's not, when you talk about chronic disease, there's no cure.
Thank you. I was just going to say, anybody that says the word cure about any of this, you just kind of need to run the other direction, because it's really walking along people in the journey of life. Events change, homes change, situations change, Amen. Weight fluctuates, animals coming in and out of their lives, allergies change. They go to a new location. Now it's like, wait a minute. I went from a no allergy zone to St. Louis, Missouri, which is where I live. We are the allergy mecca of the United States. And I see people, they're like, I don't understand. I'm from the West Coast. I'm from Colorado. Or I never had allergies. I can't breathe anymore. This is awful. Life happens. It's dynamic. It's a moving target. And we just need to walk alongside our patients and say, we're here. But it's just that awareness. They need to identify, like, wait a second. I am not breathing through my nose right now. I am not sleeping well. I am not getting a good 7 hours consistently of sleep. And when they have that awareness of their health, that's powerful, because then they can then say, hey, I need some help, and change their path again.
So with patients, young kids that I see, I literally have to partner with parents. They have to be involved, right? Because if they're not involved, like, here's we forget. Most of the time, the patient comes to you in a chair, the kid look at you and say, okay, now you're like the third person I'm seeing today. So they're in their sympathetic tone.
Yeah.
They're like all over the place. So Stacy, this is what I do. I really try to, before we even start therapy, we practice being still for 3 minutes, 1 minute at a time.
Ooh.
I bring them back in the center. Yeah.
That's excellent.
Because if they're in the limbic clock, they're not going to accept whatever you're trying to teach them. The working memory is not working.
Yeah, they're in their little reptilian brains. They're just kind of like, it's so true.
And let me tell you, when you see them, my 6-year-old, my 7-year-old boy, 8-year-old boy, 9 trying to be still, oh my God, you see all kinds of movement. But the parents look at me like, again, brain likes repetition all the time, right? So I even send them homework, just practicing being still for 1 minute, working it up for 1 minute.
That stillness.
Do you do stillness?
Look, no, Narissa, I don't. And I'm just going to be real honest. As we're sitting here, my legs are moving around. I'm like, I totally have undiagnosed ADHD. And no one ever identified it in me. I do have restless leg syndrome. So I think there is that phenotype mixed in with that too. But it's the stillness. And when I went into this path with my children, like you said, if the parents aren't, here's what can't happen. Hi, I'm showing up with little Johnny. Can you fix my kid? Yeah, that's not how myofunctional therapy works. That's not how this works. The parent has to be aware. The parent has to help the child and remember these exercises and even do them themselves. A lot of times the parents are like, holy cow, I didn't know I was doing the same thing too. But when I started on this journey with my children and I did like Buteyko breathing with them and they did myofunctional therapy, and I mean, that stillness and the awareness and the breathing and the paces and the breathing through the breathing with that diaphragm. It's like, I didn't even know how to breathe with my diaphragm. It was just, it's amazing. But like you said, the parents have to be on the team. And I think there's a struggle sometimes with today's society. Everybody's hustle bustle and they don't feel like they have time. And so I think patient selection is so important because if the parents aren't going to be on your team and a team member in this, it's just not going to happen.
You said it, team member, they have to be part of the team. I always tell them, you play a big role in the journey of your kids' airway health.
So true. So what are some things? So there are, I think for the most part, people understand there is a role and a need for myofunctional therapy. I know a lot of orthodontists partner with SLPs and myofunctional therapists to help with tongue thrust and improper swallow because they want the orthodontics, right, to be sustainable. They don't want relapse. And if you don't fix at least part of that etiology, the why behind why they have an open bite or a posterior open bite or these V-shaped arches, they're swallowing wrong, and the buccinators, the muscles of the cheeks are just slamming those teeth, it's going to relapse. So I think orthodontists have always understood that there is a role for the SLP and the myofunctional therapist for that part. But the part where people are like, really, can it really help with sleep-related breathing? Can it really help open a nose? Can it really help with potential OSA or apnea? And Christian Guilleminault, Stanford sleep physician, brilliant. He came out with his paper showing that in that population of children that he studied, that the most profound long-term resilience of the airway being improved was tonsils and adenoids being removed in combination with craniofacial development expansion, combined with, followed up by at least 6 months of myofunctional therapy at the end. And then you said you also have another paper you wanted to talk about. Another Stanford, was this another Stanford paper?
I think it's the same one that you're talking about. It was like 24 kids that had
Yes.
tonsils and adeno removal. And they were all referred to myofunctional therapy. And, you know, I'm sure you refer a lot and people would just not go, right?
Yes, I give it out. I swear I refer. I tell my myofunctional therapist in town, I love you.
The thing is, you're not right, but you're not going to stop their treatment because they didn't go to your myofunctional therapy, right?
Right. So then they get the expansion.
Right. The 11 that went have a higher in terms of residual OSA, which is 0.0 AHI, which is really good. And then the rest apparently had the average of 5-point event per hour. So that's one. And then the Camacho one, you're familiar with that too?
That one I'm not, unless maybe I'll remember when you say.
I think there's a myofunctional therapy had a reduction, I believe, is like 50% for children. I don't know. I think I misquoted that. Let me see. I always have it with me just because I always have parents or providers asking me, where's that research? Where's that research? You know?
Yeah, understood.
Yeah. And so essentially 43% reduction in children.
How long was the therapy? Did they say?
For me? Okay.
In the paper, like, did they say how long the therapy was before the reduction?
I don't think they did specifically how long, but my average therapy for me is talk about 14 to 16 months. And then when you're talking about developing good habit, it takes over a period of time. It's not really just the intensity. This is what I tell patients. It's not the intensity what I want. It's the consistency.
Repetition. New neurological pathways being, I mean, our brains are so plastic, you know, and you can reshape your brain with your thoughts. You can reshape your brain. You know, we just got to get rid of those original constant bad habits, pathways that have formed, and it takes time to get the new pathways to form. But that is impressive. And I do know that people are becoming more and more open to, and I think, you know, probably, thank goodness, I mean, there's stuff I cannot stand about social media, plenty, but there's some great things happening with social media. And I think, you know, raising awareness on this topic, I think it's helping people become more advocates of their own health and knowing that this even exists. And we can do a lot of good on social media too. And I think I'm seeing more people aware of this. What do you wish that more orthodontist dentists, pediatric dentists knew about myofunctional therapy? Like, how can we better collaborate with you? What is it that you wish people listening that are practitioners knew?
You know, like I said, you know, spending that much time with patients is not profitable for you guys, right? There's a screening tool that you could actually, the Fairy 6 screening tool that you could actually do very limited amount of time. And if you get positive those, then they make referral.
That's a good point. So the Fairest 6, it has a myofunctional component to it where you can test and just kind of screen. And
a screening tool.
Yeah, it's a screening tool. And there you go. It's part of your assessment as a hygienist. And if you see positive, what is it? How many positives? How many? There's 6 points on it?
I would say if you're positive on at least 1 or 2, there's a red flag already.
And it's like, there you go. At least get an evaluation, right?
An evaluation, right? You need a hygienist to do, especially for dentists, right? You see that. So the dentist, I don't know how you set it up on your practice. Oftentimes the hygienists see the patient first.
Yes. Yeah.
Right. So definitely that's the reason why hygienists, you need to empower your hygienist to do all of this for you, educate your patient, because it's not profitable for you to spend a whole hour about etiology, about this part of the problem.
Right. Right. And they're completely capable of doing the evaluation and seeing the signs and symptoms. You know, what's interesting too is when you look back at the hygienist and the development of the profession of dental hygiene, but you know, they didn't always exist. When the hygiene profession was developed, there was a role for more function and education back in the day. And then we got into periodontal disease therapy, right? And then the shift came where the hygienist became more of the periodontal therapist, if you will. And then we lost all the functional, because when you talk to hygienists, older hygienists, they'll tell you, we were trained in hygiene school to screen and measure in between the molars and look at swallow and look at function. They were trained to do that. And it got lost because then periodontal disease became the big heavy hitting, chunk of their day that took up the majority of their time. And then we lost that functional aspect.
So when you're right. So for me as a hygienist for how many decades, I've actually became rewarding for me when actually I involve myself in helping patient, educating them how the oral health is actually related to their metabolic disease, right?
Yes.
Like it became more empowering for me to say, oh my God, I have to educate you. And then they would become more, that's why I have a lot, when I left the dental hygiene part of it, patients are like, where do we go now? Who would I refer my friends and family? It's different when you like the feeling of, that you've actually restored the health of their gums in terms of you empower them with how to maintain oral health, like brushing, flossing. But it's different when you say, thank you for educating me about how important it is for me to wear my CPAP. Contact my provider for have a sleep study done. Now I'm aware this is the problem that I have. Now there's a reason why I wake up with headaches.
Yes.
I'm groggy an hour or so to actually get my bearing in the morning. I thought there's something wrong with me. I thought I have a brain cancer. Now
yes.
you're telling me
people
this.
are like, why didn't I know this?
Right. That's why hygienist it plays a critical role in that part of oral health.
Hey, on this topic, education, did you ever, because I've talked to some other people who, because I think the hardest thing for a hygienist is time management, right? They've got the schedule, they're waiting for the exams. It's, I've been there. I'm like, oh, for goodness sake, will they get in here already? I got another patient waiting for me. And then when you ask them,
I have to do it over again.
And I got to do it all over again. So hurry up and get in here, doc. And we're running all over. I've been both sides, and please give us some grace, hygienists, because it is really tough to run 5-6 rooms sometimes. We're tired. So we're doing our best. But the aspect of time management and incorporating some of those screenings and questions, sometimes like the feedback from my hygienist, and we're coming up with solutions in our office on, okay, how do we have more of these? They want to have the conversations. They don't want to feel rushed, because what happens, Narissa, as you know, when you open this conversation up to patients and you see their eyeballs light up because you may have identified the why behind why they feel the way they feel when nobody else has, they want to talk. They start talking and sharing. And it takes up so much time. So a thought I had heard from another person was, maybe you have them back. So we find these, sure, flags, and there's so much more we want to say. I see some flags with maybe function. I see some flags with your airway. We might need to have you be referred for a sleep study, things like that. And have them back for a second discussion, just focused on these things, like a limited exam or something like that, a problem-focused exam, so that you're not running behind, but yet you're also taking that time with the patient. And at least you've documented it, that you want to have them back. What's some advice for the hygienists that are still practicing in the dental arena, right? They're doing the scaling, root planing, checkups, whitening. They're doing all these things and they don't want to run behind, but they want to have a meaningful conversation. I mean, would you recommend that they just plant the seed and tell the patient, we need to see you back maybe for a limited exam and have a further discussion about maybe next steps for you?
That's very critical. You cannot shorten your appointment in terms of educating, right? You have to get in there and, empower them with that information. And when you're rushing, they feel it.
Yes, the
You got
patients
to
feel
connect,
it. Everybody feels it. We're
right?
all
And
tense.
like I told you earlier, I mean, empathy is really crucial, right?
Yes. Yes. And you can feel it. It's palpable.
Yeah. So take your time. Okay, how about this? How do you feel when I'm having dinner? I have my phone with me. Do you feel very special? Like I'm holding the phone right now and actually talking to you. Do you feel like you're the most important person right now?
Right.
Like I have,
No way.
right? No
You
way.
know there's
The
a
same thing when,
distraction in your second fiddle.
yeah. So with the patient, you want to have that time with them. So you don't want them to feel like you're rushing them because you got to go to the next door and take x-rays or clean the
Exactly.
room.
Yeah.
So
And
just have them
they
come back.
feel it. So
Make
having
them
them
feel like
back
they're,
and say, let's have you back for a problem focused. I mean, you can call it whatever you want in your office. We can have you back and have a sleep and breathing limited focus, exam or, function evaluation, and then refer them to the myofunctional therapist after that.
or like I do, I have a 10 to 15 minute free phone conversation with a patient before they come into my office. And I send them one generic email that I've actually put together already because this is very common, right? Sleep disorder breathing, depending on the title, sleep disorder breathing, myofunctional therapy, sleep disorder breathing, tongue thrust. I would send it to them and said, I really want you to read this information because when I see you next time, you and your child, I just want to focus on your kid for 30 minutes. And we're engaged. Nothing else matters in that world, in that room. I'm in front of that patient. I'm in front of that child. We're learning about the nose. We're learning how the tongue's supposed to be moving. So that is crucial. Patient engagement. You gotta get there. You gotta have that connection with them.
For those of you that aren't watching the video, Narissa just got right up in the camera and pointed at it and said, you got to engage. You've got to get, it was great.
Yeah, because
looking,
it's
looking
really
right
important,
at us.
right? It's kids like to engage.
Yes, they do. Oh my gosh, they do. It's so sweet. And
As they're growing up, they're learning the world. There's so many things happening to them. First, also, I don't like my kids to miss school. Yeah.
yeah,
So any of my patient kids, because that's really important in their development. Yes, this is important, but there are other development that's also we cannot forget, right? That
yes,
social development, right? So you got to engage with them. You got to connect with them. Parents need to be involved. So the family
yes,
dynamic also be important, right? You don't want to set to fail right offhand, right? You got to start. This is what I tell my kids, also my therapy. I said, sweetheart, this is what we want to do. And I did this with my kids when they were growing up. Do it once, do it right, and be done.
yeah. Do
So
it
you stop.
once, do it right, and let's be done. I like that. I love it. So if there was something that you would want to say to parents listening, is there a take home message that you would like any parent that's listening to this right now to understand?
Yes, there's hope. There's a reason why your kids are bedwetting, reason why they're acting up, waking up in the morning, they're groggy, they're possibly not breathing well during the day, especially at night. People forget, we breathe, we focus on nighttime breathing.
Right. But it's a
No,
24/7 thing.
yes,
The brain kind of likes for us to breathe. So we do it all the time.
the time.
And yeah. So
Yeah.
we see it accentuated at night. And I think we've hyper focused on the sleep aspect because it gets so much worse at night, but it's not well during the day either, usually. It's a
And like what you
compromise
said, you love,
situation. Say that
right?
again.
Like you said, I said, like we said earlier, you love social media because there's so much information out there right now, right?
Yeah,
And
there
I
really is.
always tell my patients, yeah, yeah, be careful on how information are made because they're also, you got to be critical where you're getting the information, right? Because we could get some other part of the camp that said, oh, tongue's supposed to be resting on the bottom. We
Yeah,
know it's
I
not.
have heard that.
Oh,
I've
oh
actually
yeah.
heard that in yoga, like some of the yoga classes, they'll say, let your tongue relax where it should be in the floor of your mouth. And I'm like, no, it should not be relaxed in the floor of my mouth. And then the breathing through the mouth, even sometimes in some of the yoga classes.
Yes, they will actually tell you to breathe through your mouth because to alleviate pain, to breathe through your mouth.
Yeah.
So yeah, be careful on what the information you get there. Like ASAP Pathway has a great information. The Breathe Institute has a great information. The IAOMT has great information. So there's help, and you could find good team to empower you in the journey of your kids' health.
Yes, you
I call it
can.
Airway.
Airway health.
Yeah.
And it takes a team. It takes all of us working together for such a time as this. We're all brought together to, um, you know, make an impact right now in
Divine.
the world.
Yes, yes. And it's a journey, okay? It's not like, because they think they could come to you as a dentist and expand them and you will cure them.
Yeah,
Or they come
no.
to me to cure them. I said, I always give them the triangle like this, right? You're on the top, you're the apex. You control your environment, you control your behavior. I came along on this side as a functional, help you, empower you, give you skills of the way to function. And we have the doctors to address the structure part, your dentist, your orthodontist, your ENT.
Yes. That's a
That
beautiful
triangle has
description.
to be there.
Yeah, it
Yeah.
takes it all. It takes it all together, and the importance of that collaboration and conversations like this and empowering patients to demand the care that they deserve and educate themselves, because a lot of times providers become educated through through their patients. I can't tell you how many times I've had pediatricians like reach out to me and say, why are you referring my patient here? And I always include the pediatrician. I'm not leaving them out. I'm not going rogue. I want all that patients, healthcare providers will get a letter from me as to what I'm doing, but they just are like, why? What are you doing? And then the patients go back and they explain to the other healthcare providers that this wasn't really on their radar, right? And now it's a little bit more on their radar, and they might recognize it now in the next patient. So patients, you need to understand too, we don't learn this in medical school or dental school or hygiene school. This is additional training we've had to have outside and furthering our education. We're hoping that the schools start incorporating it. It's a work in progress. But in the meantime, you as the patient, educate yourself, empower yourself, and don't give up. Like Narissa said, there's hope. There are answers for the why. There's hope. There's a lot of hope. Okay, I'm going to wrap up with a couple of questions with you, sister. Just taking you back to your childhood. What was your favorite toy growing up when you were little?
I was a tomboy.
What? Okay, what did you do?
Yo-yo was my favorite one.
Oh, yeah, the yo-yo. Did you have the orange yo-yo with the white butterfly on it? I forgot what that one was called. Like everyone had that orange yo-yo.
Mine was made out of just wood.
A wooden
Just
yo-yo.
wood.
What would
Wooden
kids do
yo-yo.
today? I would love to just plop a yo-yo down in front of my kids today and say, okay, that's what you get to do today, and see their faces.
Well, that was part of my my prices for my kids too that finished some of the therapy. I would give them yo-yo and we would just do yo-yo in the office.
And it's such an intentional, I mean, that's focus, you know?
Yeah, we're engaged. I'm engaging my patient.
That's right. And we don't do that anymore. I mean, everything's distractive and busy. A yo-yo is, ooh, I like it. I'm going to get some yo-yos in my practice.
Yes. Focus. Yeah. kids needs to be back in center. Like, bring them
Yeah.
back.
Bring them back. I love it. Okay. Chocolate or vanilla?
Chocolate.
Okay.
Bad. Don't eat it before sleep.
Oh, yeah. Yeah, that's true. Don't have chocolate before sleep. But I will say this dark chocolate is better than milk chocolate. It even helps fight decay. Really, really, really high cocoa concentration. Like, I think it's 82% or higher. It actually helps fight decay. But, I
I
still like
was
to
still
have.
go for milk.
You still what?
No, no dark for me. No
Oh,
dark
yeah.
milk. No
You
dark.
still like the milk. I had to force myself to kind of like the dark. I still would prefer a Dove milk chocolate any day.
I'm all or nothing. So if you're gonna give me give me all the milk chocolate, please.
What was your favorite class in school when you were a kid?
It's funny. I did really well in geography, but I
Oh,
suck on it right now. I just don't. I don't. I just
so
elementary
you're
school. I think I was so focused. Yeah,
so
geography
geography.
was my thing back in. That was my jam, and now I'm like, wait a minute. In my search and rescue, I tell them, do not put me as a navigation because we will be lost.
I'm the same way. I mean, my husband, you could drop him off in the middle of nowhere and he'll remember how he got there. I can go to the same place 100 times, especially if I'm a passenger because I'm not paying attention. And my brother's the same way. We are both like, what gene are we missing that we have no idea where to go to get back out of here?
Nope. So no,
Oh,
that
I
was my
love it.
thing.
Well, thanks for being with us, Narissa. And I'll talk to you too about if there's any way, if you want anyone, because I know you're like, I don't want to work that hard. But if anybody wants to reach out, maybe we might have a link. We'll see. We'll see how hard Narissa wants to work.
Thank you. I love you. I love ASAP Pathway. Thank you for what you guys do. My
Thank
loyalty is
you.
big. I
Well,
loyally, my husband knows. So like my husband knows who I'm very loyal person.
well, you are. I mean, we cannot thank you enough for your support of ASAP. It means a lot to us. And I mean, let me just tell you, at the American Dental Association, we had a booth there, and Narissa worked that booth like I have never seen anybody. I mean, she was like a cheerleader, so excited, talking to people. I mean, she had a line. People wanted to talk to her because your passion oozes out of you and you're authentic. And I think that's what this world is craving is care, compassion,
Empathy.
vulnerability, empathy, and just being authentic. And that sums you up. And I appreciate everything you're doing in the world, and you're going to have a great big ripple effect. And I just appreciate your friendship just as much. Thanks for being on with us today.
Thank you for having me, Stacy.
All right. I'll see you soon.
I'll see you soon. Bye-bye.
Bye.